Hello everyone. The topic of my presentation is Principles of Tooth Preparation. The contents will include introduction, definitions, biomechanical principles according to Schillingberg, Wien's diagram according to Rosenstiel, then preservation of tooth structure, retention form, resistance form, structural durability of the restoration, marginal integrity, preservation of the periodontium, aesthetic considerations, introduction to instruments, common errors, current concepts, conclusion, and references. The preparation of tooth to receive any kind of restoration requires extensive armamentarium, skills, and most importantly, following the extensive principles of preparation. Sound judgment needs to be exercised while taking the principles into consideration. The need of extensive principles. Why do we need such extensive principles? Despite advances, traditional crowns are still indicated for majority of patients. The classic design of the preparation must be visualized so that modifications, if required, can be instituted. Diagnosis and disciplined tooth preparation are therefore essential to successful fixed prosthetics. Now, the definition, according to GPT-9, tooth preparation is defined as the process of removal of diseased and or healthy enamel and dentine and cementum to shape a tooth to receive a restoration. According to Tillman, tooth preparation may be defined as the mechanical treatment of dental disease or injury to hard tissue that restores a tooth to the original form. According to Marzouk, it is the mechanical preparation or the chemical treatment of the remaining tooth structure which enables it to accommodate a restorative material without incurring mechanical or biological failure. Now, the objectives of tooth preparation, they are tooth reduction to provide retention, then preservation of healthy tooth structure for resistance form, acceptable finish line, and pragmatic axial tooth reduction to allow the tissue responses, to allow favorable tissue responses from the crown contour. Now, the biomechanical principles of tooth preparation. According to Schillingberg, the design of a preparation for a cast restoration and the execution of that design are governed by 5 principles: preservation of tooth structure, retention and resistance, structural durability, marginal integrity, and preservation of the periodontium. According to Rosenstiel, an optimal restoration requires biologic, mechanical, and aesthetic requirements. The biologic requirements include conservation of tooth structure, avoidance of over-contouring, supragingival margins, harmonious occlusion, protection against tooth fracture. The mechanical requirements include retention form, resistance form, and deformation. The aesthetic requirements include minimum display of metal, maximum thickness of porcelain, porcelain occlusal surfaces, and subgingival margins. All these 3 will contribute to an optimal restoration. Now we come on to the first principle, that is preservation of tooth structure. It includes preservation of adjacent teeth, soft tissue, as well as pulp. Now, excess removal of tooth structure can have many ill effects. Over-tapered or shortened preparation would lead to sacrifice of retention and resistance form. And if it approaches too close to the pulp, this may lead to thermal hypersensitivity, pulpal inflammation, and necrosis. Majority studies and clinicians say that full coverage restorations offer superior retention and resistance. Preservation also entails and reinforcement and protection of remaining enamel and dentine, also protecting the underlying cusps. Conservation of tooth structure by using partial coverage restorations may be considered. In this case, they are used as fixed dental prosthetic abutments to replace congenitally missing lateral incisors. Then adjacent teeth. Damage to the adjacent teeth is prevented by positioning the diamond so that a thin lip of enamel is retained between the burr and the adjacent tooth. Note that the orientation of the diamond parallels the long axis of the abutment tooth. The enamel should be maintained mesial to the path of the diamond as the reduction progresses. Then soft tissue. Damage to the soft tissues of the tongue and cheeks can be prevented by careful retraction with an aspirator tip, mouth mirror, or flanged saliva ejector. Great care is needed to protect the tongue when the lingual surfaces of mandibular molars are being prepared. Then pulp preservation. Temperature can lead to friction, high temperature can be caused by friction, so to prevent that, water spray should be used and retention features should be incorporated at low speed. Now, chemical action. There are certain materials which have a chemical action on freshly cut dentine. To prevent this, cavity varnish or dentine bonding agents may be used, and cleaning and degreasing agents help to remove pulpal irritants. Then bacterial action, all the caries dentine is removed and bacteria may gain access through micro leakage. To prevent this, zinc phosphate cement can be used, which has antibacterial properties. Then retention and resistance. According to GPT-9, retention is defined as that quality inherent in the dental prosthesis acting to resist the forces of dislodgement along the path of placement. Resistance is defined as the feature of tooth preparation that enhances the stability of the restoration and resists dislodgement along an axis other than the path of placement. If it is not firmly attached to the tooth, a restoration cannot meet its functional, biological, and aesthetic requirements. It should withstand dislodging forces. Some of the forces can be known by the degree of wear on other teeth, the thickness of supporting bone, and the bulk of the masticatory muscles. The geometric form of the preparation is the most important factor under the control of the operator, which determines the cementation capacity of the restorations. Geometric form determines the orientation of restoration interfaces to the direction of forces encountered and further determines tension, compression, and shear. According to Schillingberg, retention is the ability of the preparation to impede removal of restoration along its path of insertion. Under this condition, the cement bond is subjected to tension and shear. Resistance is the ability of the preparation to prevent the dislodgement of the restoration forces directed in apical, oblique, or horizontal direction. The effective resistance is obtained when the cement placed is under compression. Then retention. There are 4 factors which influence the retention which are under the control of the operator. That is the degree of taper, the total surface area, area under shear, and surface roughness. Now, taper and retention. The axial walls of the preparation must taper slightly to permit the restoration to seat. That is, 2 opposing external wall must gradually converge or 2 opposing internal surfaces of the tooth structure must diverge occlusally. The terms angle of convergence and angle of divergence can be used to describe the respective relationships between the 2 opposing walls of a preparation. Parallel walls offer maximum retention. Taper is usually needed to visualize preparation walls, prevent undercuts, and permit more nearly complete seating of the restorations during cementation. The ideal taper is 6 degrees. As the taper of the preparation increases, the retention decreases. That means the taper and retention are inversely proportional to each other. There are various schools of thought regarding the taper of the preparation. Prothero in 1923 indicated that convergence of peripheral surfaces should range from 2 to 5 degrees. According to Jorgensen, 1955, he found that retention decreases as the taper increases. A range of 2 to 6.5 degrees has been considered to be optimal. He tested the retention of crowns at various angles by applying a tensile force on cemented crown. Maximum strength was obtained at 5 degrees. Ebnashi in 1969 indicated that to minimize stress in the cement interface between the preparation and the restoration, a taper of 2.5 to 6.5 degrees has been suggested optimum. but there is only a slight increase in stress as taper is increased from 0 to 15 degrees. However, at 20-degree taper, stress concentration was found to increase sharply. Mack in 1980 estimated that a minimum taper of 12 degrees is necessary just to ensure the absence of undercuts. The tendency to over-taper preparations must be avoided in order to achieve maximum retention. The surface area. Greater the area of the cement film bound to the preparation and to the internal detail of the casting, greater the retention. The total surface area is influenced by the size of the tooth, the extent of coverage by the restoration, and features such as grooves, boxes, etc. Now, the length of the preparation is an important factor in retention. Longer preparations will have greater retention as compared to short preparations. Greater surface area with a large diameter will have greater retention. Now, area under shear. Shear is more important than tensile stress for cements when forces act along the path of insertion. For this, two surfaces of the preparation in separate planes must be nearly parallel to each other, or a combination of internal and external walls. The freedom of displacement. Maximum retention is achieved when there is only one path. A full veneer preparation with long parallel axial walls and grooves would produce such retention. On the opposite extreme, a short over-tapered preparation would be without retention because the restoration could be removed along an infinite number of paths. Now, this picture depicts that this preparation having grooves will have a single path of insertion as compared to this preparation which can have multiple paths of insertion. Now, limiting the freedom of displacement from torquing or twisting forces in a horizontal plane increases the resistance of a restoration. A groove whose walls meet the axial wall at an oblique angle does not provide the necessary resistance. V-shaped grooves produce roughly 1/2 as much resistance to lingual displacement as do grooves with a definite lingual wall. As you can see in this picture, this groove doesn't have a definite lingual wall. So this can lead to loss of retention. On the other hand, this groove with a definite lingual wall can resist the rotational forces. Similarly, buccal and lingual walls will not resist the displacement if they meet the pulpal wall at oblique angles. On the contrary, if they meet the pulpal wall at an angle of 90 degrees and then a bevel is given, the retention would be much more. Now, the surface roughness. The adhesion of dental cements depends primarily on the projections of the cement into the microscopic irregularities and recesses on the surfaces being joined. Therefore, the prepared tooth surface should not be highly polished. Now, the resistance. If the restoration is subjected to sliding or tipping forces, this may lead to cement film disruption. This further can lead to percolation of fluids, recurrent caries, and ultimately the restoration is doomed. However, if the restoration is more perpendicular to the force, greater will be the resistance. This is because the cement will be in compression and therefore failure is less likely to occur. Now, leverage and resistance. Strongest forces are apically directed and can produce tension. Leverage, probably the predominant factor in the dislodgement of cemented restoration, occurs when the line of action of a force passes outside the supporting tooth structure. Leverage occurs when the line of action of a force passes outside the supporting tooth structure as depicted in this diagram. If the force passes within the margin of a crown, no tipping of the restoration will occur when compared to the line of action passing outside the margins of the restoration. A force applied at an oblique angle will produce a line of action passing outside the supporting tooth structure. Now, if a line is drawn from the center of rotation perpendicular to the cement film on the opposite wall of the preparation, the point where the line intersects the cement film is known as the tangent point. Now, in this picture, P1 is the tangent point. Now, at P2, the restoration is subjected to compression forces. Now, this P2 and all points occlusal to P1 are subjected to compression, which is better tolerated by the restoration if it is long. Now, if at this point P3, the cement film is subjected to tension. Now, all the points apical to P1 are subjected to tension. Now, the mechanical resistance is provided only by the points which are occlusal to the tangent point. Now, if the tangent points of all the arcs of the rotation around a given axis are connected, they form the tangent line. The area above the tangent line is called the resisting area. Now, to have effective resistance, the tangent line should extend at least halfway down the preparation. Now, preparation of length and resistance. Shortening the preparation will produce a proportional greater diminution of the resisting area. Now, the ability of the restoration not only depends on the preparation, but also the magnitude of torque. Forces also work here with the primary lever arm. Now, shortening of the preparation will reduce the resistance. Now, if a small restoration is given on a small preparation, that is less likely to fail through tipping than a long restoration. Now, in short crown, lifting force is small when compared to long crown. As you can see, the arc of rotation of the in a short preparation is very low. Okay, and in a similar in a similar height crown with a longer restoration, the arc of rotation is longer. So it is more likely to fail. Now, taper and resistance. More tapered a preparation, less is the resistance. There is no taper, the resisting area covers half the axial wall. Ideal taper, again, half the axial wall is covered. Now, over-tapered preparation leads to smaller resisting area near the occlusal surface. A taper of a preparation is directly proportional to the height to width ratio. A taper that permits an effective resisting area for a preparation in which the height to width ratio is 1:1 is double than in a preparation where the height to width ratio is 1:2. Now, rotation around a vertical axis. A partial veneer crown which has no grooves offer little resistance to rotation. However, the lingual, if the grooves are incorporated, the lingual wall of the groove will resist the rotation. Now, in this, axial symmetry of a full veneer crown preparation may allow rotation of the restoration. However, if the restoration, if the preparation is being, if the tooth preparation is prepared with wings, the resistance form is enhanced, and there is resistance to rotation of the restoration. Then path of insertion, according to GPT-9, it is defined as the specific direction in which a prosthesis is placed on the residual alveolar ridge, abutment, teeth, dental implant abutments, or attachments. It is determined mentally by the dentist before the preparation is begun, and all features of the preparation are cut to coincide with that line. If the center of the occlusal surface of a preparation is viewed with one eye from a distance of approximately 30 centimeter or 12 inches, it is possible to sight down the axial walls of a preparation with a minimum taper. For a preparation to be surveyed in the mouth, where direct vision is rarely possible, a mouth mirror is used. It is held at an angle approximately half inch above the preparation, and the image is viewed with one eye. If fixed partial denture abutment preparations are being evaluated for a common path of insertion, a firm finger rest is established and the mirror is maneuvered until one preparation is centered. Then, pivoting on the finger rest, the mirror is moved without changing its angulation until it is centered over the second preparation. Then, structural durability of the restoration. A restoration must contain a bulk of material that is adequate to withstand the forces of occlusion. This bulk must be confined to the space created by the tooth preparation. Only in this way can the occlusion on the restoration be harmonious and the axial contours normal, preventing periodontal problems around the restoration. Now, there are preparation features that contribute to the durability of the restoration. Those are occlusal reduction, functional cusp bevel, axial reduction, and reinforcing struts. Now, occlusal reduction. One of the most important features for providing adequate bulk of metal and strength to the restoration is occlusal clearance. For alloys, there should be 1.5 mm of clearance on the functional cusp, that is, lingual of maxillary molars and premolars and buccal cusps of mandibular molars and premolars. Now, for a gold crown, the occlusal reduction is 1.5 mm. For metal ceramic, it requires 1.5 to 2 mm of clearance. And for all ceramic crowns, 2 mm of occlusal clearance is required. Now, functional cusp bevel. An integral part of the occlusal reduction is the functional cusp bevel. A wide bevel on the lingual inclines of the maxillary lingual cusps and the buccal inclines of mandibular buccal cusp provide space for an adequate bulk of metal in an area of heavy occlusal contact. If a wide bevel is not placed on the functional cusp, several problems may occur. To prevent a thin casting when there is no functional cusp bevel, an attempt may be made to wax the crown to optimal thickness in this area. An over-contoured restoration will result and a deflective occlusal contact is likely to occur unless the opposing tooth is reduced. Now, axial reduction. Second prerequisite for structural durability is axial reduction. When it is sufficient, restoration walls have satisfactory thicknesses without over-contouring. As you can see in this, the contours of the crown are normal, whereas this restoration has an over-contoured margin. Now, reinforcing struts. The features that serve to provide space for the metal that will improve the durability and the rigidity of the restoration are offset, occlusal shoulder, isthmus, proximal grooves, and the box. Isthmus connects the boxes and the offset ties the grooves together to enhance the reinforcing truss effect. Then marginal integrity. The restoration can survive in the biological environment of the oral cavity only if the margins are closely adapted to the cavo surface finish line of the preparation. The configuration of the preparation finish line dictates the shape and bulk of the restorative material in the margin of the restoration. It also can affect both marginal adaptation and the degree of seating of the restoration. The three requirements of successful restorative margins, they must fit as closely as possible against the finish line of the preparation to minimize the width of the exposed cement. They must have sufficient strength to withstand the forces of mastication. Whenever possible, they should be located in areas where the operator can finish and inspect them and the patient can clean them. Now, according to GPT-9, finish line can be defined as the point at which a preparation terminates on the tooth is called the finish line. It is also defined as the peripheral extension of a tooth preparation. What are the functions of finish line? During visual evaluation of the tooth preparation, it is a measure of the amount of tooth structure already removed. It also delineates the extent of the cut in an apical direction. The more distinct it is, the better it serves these purposes. The finish line is one of the features that can be used to evaluate the accuracy of the impression made for indirect procedures. In the die, a distinct finish line helps to evaluate the quality of the die and helps in accurate die trimming. The correct marginal adaptation of the wax pattern depends on an obvious finish line. The evaluation of the restoration is also aided by a proper finish line. At cementation, a sharp finish line aids in determining whether the restoration is fully seated. Now, metal margins should be ideally acute and cross-section rather than right angle to facilitate a closer fit. Now, capital D is the distance by which the crown fails to seat. Small d is the shortest distance between the tooth structure and the restoration. Now, if the inner angle of the metal margin forms an angle M of less than 90 degrees with the path of insertion, as does a bevel or a chamfer, small d will be smaller than capital D. Now, the shortest distance from the casting margin to the tooth structure D can be stated as a function of capital D and the sine of the angle M or the cosine of the angle P, which is the angle between the surface of the bevel and the path of insertion. Now, D is equal to D sine M or D is equals to D cos P. As the angle M is reduced, its sine value also reduces and so does the value of D, thus reducing the marginal discrepancy. Now, types of finish line. There are various types of finish lines such as feather edge, knife edge, chamfer, bevel, shoulder, and beveled shoulder. Now, we'll discuss each advantages and disadvantages as well as indications of each. Now, feather edge. The advantage is it allows conservation of tooth structure, but it does not provide sufficient bulk. Therefore, it is not recommended. Now, chisel edge or knife edge. Again, advantage is conservation of tooth structure. Disadvantage is location of margin, difficult to control. Indication, it is indicated on occasionally on tilted tooth. Then chamfer, it has a distinct margin, adequate bulk, easier to control. Disadvantage includes care is needed to remove unsupported lip of enamel. Then indication used in cast metal restoration. Then heavy or deep chamfer, bulk of material plus advantage of round internal angles. It is less conservative and is indicated on the facial margin of metal ceramic and all margins of full ceramic restoration. Then shoulder allows bulk of restorative material. Disadvantage is this less conservative and is indicated on facial margin of metal ceramic and all margins of full ceramic restoration. The sloped shoulder, also called as radial shoulder, allows bulk of material plus advantage of bevel is less conservative and indicated in facial margin of or metal ceramic and all margins of full ceramic restorations. Then shoulder with bevel allows bulk of material plus advantage of bevel, is less conservative and extends apically. Facial margin of metal ceramic and all margins of full ceramic restorations with supragingival margins. These are the various burrs which are used. That is parallel sided flat and tapered burr is used to create depth grooves for occlusal as well as buccal surface. Then flat ended tapered diamond used to prepare occlusal surface, axial surface, box preparation and for large grooves. Then long round ended tapered used to prepare occlusal surface, axial surface and proximal surface. Then long needle, proximal slice to make room for round-ended tapered diamond bow. Then rugby burr, it is used for lingual or palatal surfaces. Then smooth round-ended tapered, used to refine margins and finish line and round the sharp junctions between the prepared surfaces. Then preservation of the periodontium. Includes margin placement. Margin placement has a direct effect on the ultimate success of the restoration. Margin should be as smooth as possible. Should be placed in an area where that can be finished well by the dentist and kept clean by the patient. Placed in enamel whenever possible and should be supragingival whenever possible. Now, supragingival margins have certain advantages such as less potential for soft tissue damage, easily prepared and finished, more easily kept clean, impressions are more easily made, and restorations are easily evaluated at recall appointments. Subgingival margins, the indications include aesthetics, then existing caries, cervical erosion or restorations extending subgingivally, and crown lengthening is not indicated. Proximal contact area extends to the gingival crest. Additional retention is needed. Margin of a metal ceramic crown is to be hidden behind the labiogingival crest. Then root sensitivity cannot be controlled by more conservative procedures such as the application of dentine bonding agents. A finish line should not be closer than 2 mm to the alveolar crest. Now, if the finish lines are placed in this area, this may lead to gingival inflammation, loss of alveolar crest height, or pocket formation. The crown lengthening may be performed to surgically move the alveolar crest 3 mm apical to the location of the proposed finish line to preserve the biologic width and prevent periodontal pathology. Now, this will allow space for the connective and epithelial attachments and a healthy gingival sulcus. Now, coming on to the aesthetic considerations, the restorative dentist should develop skill in determining the aesthetic expectations of the patient. Patients prefer their dental restorations to look as natural as possible. However, care must be taken that the aesthetic considerations are not perceived at the expense of the patient's long-term oral health or functional efficiency. Whenever possible, accomplishment of an aesthetically acceptable result without the use of metal ceramic crowns is preferred, not only because tooth structure is conserved, but also because no restorative material can approach the appearance of intact tooth enamel. These are the list of instruments which are required for the preparation. Now, the common errors of tooth preparation: insufficient occlusal or incisal reduction, then lack of uniform reduction of labial or buccal surfaces compromising aesthetics, minimum axial reduction on the buccal and lingual surface of the posterior teeth, which increases the incidence of working prematurities. The distinction between reduction and clearance is crucial. Inappropriate proximal reduction, which prevents having a cleanable embrasure space, over reduction of teeth and or violation of the biologic width, insufficient gingival reduction to accommodate a definite finish line, undercuts on the distal lingual surface of the preparation and or lack of parallelism of the FPD abutments, failure to contour proximal surfaces of adjacent teeth to allow seating of restoration. The current concepts in tooth preparation, according to Charles Goodacre, teeth should be prepared so that the facio-proximal and linguoproximal corners are preserved. Teeth without natural circumferential morphology after tooth preparation, that is round teeth or teeth that lack adequate resistance form, should be modified with the creation of grooves or boxes. Many molars need auxiliary grooves or boxes to enhance the resistance form because of their short occlusocervical dimensions and the unfavorable ratio of the occlusocervical dimensions to the faciolingual dimensions. Axial grooves or boxes should be used routinely when mandibular molars are prepared for fixed partial dentures, and they should be located on the proximal surfaces. When tooth conditions and aesthetics permit, finish lines should be located supragingivally. When subgingival finish lines are required, they should not be extended to the epithelial attachment. Chamfer finish lines approximately 0.3 mm deep are well suited for all metal crowns. Both shoulder and chamfer finish lines can be used with all ceramic crowns if the crowns are bonded to the prepared teeth. Depths greater than 1 mm are not required when a semi-translucent type of all ceramic crown is used. Axial and occlusal reductions for all metal crowns should be at least 0.5 mm deep and 1 mm deep respectively. For metal ceramic crowns, facial or axial reductions in excess of 1 mm can compromise the remaining tooth structure external to the pulp, whereas 2 mm of occlusal reduction is commonly achievable even on a young tooth. With all ceramic crowns, it is not necessary to exceed 1 millimeter of axial reduction with semi-translucent systems and higher value lower chroma shades. 2 mm incisal or occlusal reduction for all ceramic crowns. To conclude, often these principles conflict and the clinicians must decide how the restoration should be designed. Each tooth preparation must be measured by clearly defined criteria which can be used to identify and correct problems. It is important to understand the pertinent theories underlying each step. Successful preparations can be obtained by systematically following these steps. It is important to critically evaluate each step before proceeding to the next step to ensure an optimal quality final restoration which will serve the patient for a long time. Thank you. These are my references.